All right, thanks, Ashley. November is National Hospice Month, a time when the home care and hospice community honors the millions of nurses, home care aides, therapists, and social workers who make a remarkable difference for patients and the families they serve. It's also an opportunity to learn more about this service and what it can offer. Here to talk about what hospice can offer family and loved ones living with a life-threatening illness is Dr. Ross Albert, Hospice and Palliative Care Medical Director for Hartford HealthCare. Doctor, welcome.
Thank you for having me.
Hartford HealthCare at home, I should say. All right, so what are some of the reasons to consider hospice?
Yeah, when we think about when somebody's should start thinking about hospice, we generally think about when patients and families are transitioning their goals from a more aggressive or more treatment-directed plan to one that's focused more on comfort, one that's focused more on symptom control, one that's focused on trying to keep them at home as opposed to going back and forth to the hospital or going through other procedures or things that might add to their burden of their life.
I've been through it with my grandmother and my father, and they made it so wonderful for us. Who is eligible for hospice?
When we think about eligibility for hospice, we talk about two pieces of that. One is around, as we said, their goals. So these are patients and families who are electing to focus on quality of life, focus on symptom support, focus on staying out of the hospital. The other is around a prediction around life expectancy. So all hospices are following Medicare guidelines that say that hospice is for people who have a predicted life expectancy less than 6 months. And that comes from their physician and the hospice physician making their best estimate around that prognosis. We know we don't have a crystal ball, and if someone reaches 6 months while they're on hospice, we can actually recertify them to keep supporting them if they're appropriate.
All right, tell us what services hospice care includes.
The really unique thing about hospice, one of the really wonderful things about hospice, as you said, is that hospice is a team-based approach. So a person's doctor stays involved in their care, but the hospice team consists of nurses, social workers, chaplains, volunteers, home health aides. Hartford HealthCare at Home has a music therapist, veteran support as well. So it's really that team-based approach. Patients, their insurance covers their equipment, their medications to support them in place for their care.
All right, quick last question. Where does hospice care take place?
That's a great question. So one of the best things about hospice is hospice can happen wherever a person calls home. So it can happen in their house, it can happen in assisted living, a nursing home, it can happen in the hospital for people who really need that aggressive symptom management, but for the most part it happens, again, wherever that person and that family calls home.
All right, Dr. Ross Albert with Hartford HealthCare at Home, thank you for joining us.
Thank you very much.